Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. This is the show designed to change your health using the latest techniques in the field of natural health care. And the truth is, ladies and gentlemen, is we've made huge strides in the field of wellness whenever it comes to natural ways to get sick people well. And so natural health care has advanced just like every other profession advances over time. We're really starting to get this thing figured out in ways to get the body to go from sickness and in disease to good health and more energy and less chronic health problems. And today I have to get on my soapbox a little bit with you guys and rant about something that happened to me in practice this week. And I just feel like you guys need to know about this. And it actually happened twice this week in practice. And I just felt compelled to come on and talk to you guys about this today. What happened to me was, and I had two different patients say something very similar to this. And they both said something to the likes of, well, doc, yeah, I have diabetes, but I just have the normal diabetes. It's fine. My meds are under control and I'm fine. I just have the normal diabetes. And then they rated themselves. I always ask my patients on a scale of 1 to 10, how would you rate your health? They both rated themselves like an 8 or 9. I think one was an 8 and one was a 9. And of course, I kind of gave them this look like, how is that possible? There's no such thing as normal diabetes. So explain that to me, please. And so, well, doc, my blood sugar was up a little bit. So my doctor put me on metformin and my numbers look good. So I'm healthy now. Everything's fine. I just have normal diabetes. And what people are surprised to find out and what the general public doesn't know is all of the complications of diabetes. And by complications, guys, I mean number one cause of blindness. Diabetes is the number one cause of blindness. You have a 4 times greater risk of getting dementia. 1/3 of diabetics end up on kidney dialysis. It increases your chance of heart attacks and cancer. Neuropathies increase, which is a numbness down into the feet and burning in the feet. Number one cause of amputations in the lower limbs. So I wouldn't call any of that normal. And what people don't understand and are surprised to find out is that most of these terrible complications of diabetes happens to people that were controlling their diabetes. So these complications happen to the people that had quote unquote normal diabetes. And of course, there's no such thing as just having normal diabetes. Diabetes is a chronic disease. It's a life-altering chronic disease, and I feel like people don't take it serious enough. I think it's so common that people just think, well, yeah, I just have, the normal diabetes, and I'm controlling it with my medication, and I'm good. I'm a pretty healthy person. But they're doing very little to stop these complications from happening to them later on in life. And the reason that happens is because most of these complications are not from blood sugar being off. Most of it happens whenever your insulin balance gets off. And what we find out today is that we're not even checking insulin. Insulin is not something that they ever check whenever they look at the diabetic patient. All they check is blood sugar and A1C. Now, A1C is simply blood sugar over time, but it's the insulin levels that cause many of these complications like, losing limbs and blindness and these other complications that I went over. So there's definitely no such thing as normal diabetes, and it's not something to take lightly because most of the blood work that's done, in fact, every blood work I've ever seen from another office, all that's checked is blood sugar, which is glucose, and A1C. But what about insulin? Why don't we check insulin? Insulin is what controls blood sugar. So why would we not want to check and see what the patient's insulin level is? Diabetes is a disease of insulin, not of blood sugar. And what about leptin? Leptin is the hormone that controls insulin output. So we have a saying in natural healthcare that we want to get as far upstream in these conditions as we possibly can. And my point is that blood sugar and A1C are very downstream in the disease called diabetes. Insulin is upstream, and leptin is even further upstream from that in the discovery of where is this originating in the body? What's happening to cause this insulin and not to work and not to be able to put the sugar inside the cell to be used? So keeping your blood sugar under control and only looking at blood sugar leaves a lot of information undetected, and it's dangerous for patients to do that. Because when your insulin gets out of control, that's when things really get serious. But if you're not checking it, how do we even know? And so now they even have type 3 diabetes, which basically means that your pancreas has just completely given out because of these factors that were ignored. So we really need to take a look at all of these factors to see if there's something that can be done to get all of these numbers under control. And if we're going to try to have this patient avoid these terrible complications of diabetes, we need to look as far upstream as possible. Nobody wants to go on kidney dialysis or lose their legs or be blind, but people don't realize that that's the direction things are headed, even if things are being quote unquote controlled. So if you want to get these complications under control, we need to figure out what you can do to improve your situation in not just your blood sugar and A1C numbers, but also in your insulin and leptin numbers and several other factors as well. Like, what's the health of your liver doing and kidneys, and what are your inflammatory factors, and several other things that I'm going to get into today. But type 2 diabetics have a much greater risk of dealing with severe health complications, even if it's being managed. And it's so unfortunate that more people don't know this, and they don't take more action to try to figure out where some of this stuff started from in the first place. Because imagine a life they could be living without all of these complications like lost limbs and blindness and kidney dialysis. And imagine the more energy and the better health and the longer life these patients could have if we could just figure out some of these underlying secrets to these upstream conditions and that's causing this, downstream blood sugar problem. And guys, the truth is diabetes is no longer a life sentence anymore. And if anybody tells you that, they are just plain wrong. There are people solving their diabetes and turning their life around every single day. We hear about it all the time. There's people every day that are figuring out a healthier pathway that they can get on so that they can avoid all of these complications. And the truth is, it's not even that complicated to do that. So we're going to dive into all of that on the show today. So if you have diabetes or blood sugar problems or weight problems or fatigue, you want to stay tuned because we're going to talk about some of the secrets to, trying to turn some of this stuff around. And if you know somebody that's a diabetic or somebody that has any of these issues, call them and text them right now and tell them to tune into the rest of the show. It could prevent them from a lot of misery down the road. And guys, that's my purpose every day for coming and coming to practice and doing this show is to try to help as many people as I possibly can live a longer, healthier life using totally natural solutions. I talk about something very often called the tale of two paths. So we have two ladies that have been friends for, 20 years, and they're both 70 years old now. And one of them is out gardening and golfing and, shopping with her friends and planting a garden, just having the time of her life. And the other person is maybe, unfortunately, still 70 years old, maybe in a nursing facility or using a wheelchair or, can't even walk to the end of the driveway to check her mailbox. Now, they're both 70, so it has nothing to do with their age. But their health at one point took a very different pathway. One of them their health took a pathway that led them to be able to garden and play tennis and shop with their friends. And the other one, unfortunately, their health took a pathway that led them to chronic disease and a life of misery. Now, those two paths did not deviate at 70 years old, or even 65, or probably even 60. Years, if not decades before, one of them decided to take action to do something to put themselves on a healthier pathway, and the other one, unfortunately, did not. Now, that fork in the path happens way before the disease process starts. So let me ask you, what path are you on? My job every day is to show people the healthier path. What does it take to get this patient on a pathway where they can be the 70 or 80-year-old that's having the time of their life and avoiding these terrible pitfalls that come from ignoring chronic disease until it's too late? And diabetes is a chronic disease. It is a life-altering condition. So if you have diabetes, please don't take it lightly. You don't want to end up with some of these terrible complications that happens to so many diabetics that got lulled into this false sense of, well, it's not really that big of a deal. So we're going to dive into some of the causes and solutions to diabetes when we get back from this short break. So don't go away. And if you know somebody with diabetes, text them and tell them to tune in. Don't go away, guys. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining us today. And we're discussing diabetes and all of the complications and issues that comes along with that. And we were starting to get into some of the advancements in natural health care in that last segment. And the truth is, we're really starting to figure some of these things out in the field of natural health care. There are some very effective things that you can do to change your cellular processes other than using chemicals, because that's what medicine does. It uses chemicals to change your body's cellular processes. So are there other ways to change your body's cellular processes? Well, of course there are. There's lots of things that you can do to make your cells work better. And that's always the question that we start with whenever we are evaluating a patient using natural health care. Why are the cells doing what they're doing? And how can we make the cells work better? And if we can answer that question, like why are these cells malfunctioning, and what can I do to make them stop doing what they're doing and do something healthier for this patient? Because, guys, America now takes 50% of all the pharmaceutical drugs on planet Earth, but we're less than 4% of the world's population. We have more doctors and hospitals than any other country in the world, and we spend more on healthcare than most of the developed world combined, yet China and Cambodia have a longer life expectancy than we do. Now, there's places in Cambodia where they might be miles from any healthcare. They might be days and days walk from any kind of healthcare system. Sometimes their water might not be the cleanest, and they outlive us. So if the answer to achieving a longer life was, more medicine, more hospitals, and more money, wouldn't we all have the longest lifespan on the planet? And that's not what's happening. Now, in our last segment, I was giving you guys some astonishing statistics on diabetes. And keep in mind, 1/3 of you out there listening already has prediabetes. That's right. 35% of the adult population in America has prediabetes. So if you're listening with two other people, one person in that room probably has prediabetes, meaning if you don't reverse the direction that you're headed, you will end up with full-blown diabetes very soon. 50% of Americans over 65 have prediabetes. So if you're listening to this and you're over 65, it's you or someone next to you has prediabetes already. And honestly, guys, in Acadiana, it's probably more than that. It's probably more than those national average statistics, because we have a little higher rate, well, actually a much more higher rate of health problems here than other places. So 70% of the people with diabetes develop diabetic neuropathy, which is burning and tingling in the feet, and which the end stage of that is amputation. 60% of leg amputations are from diabetes. Diabetes is the leading cause of kidney failure and the leading cause of blindness. So in the first segment, I was telling you that patients come in and go, "Doc, I just have normal diabetes." These people are in real trouble for two reasons. Number one is they have a chronic disease, but secondly is the way they look at that chronic disease is putting them in real danger. So we have to deal with both issues. We have to deal with the way they're looking at their health, and we have to also deal with the chronic disease itself. But it's just because nobody's told them. They have no clue. Nobody's taken the time to sit down and show them what diabetes even means in their body and what happens and the statistics that's involved if you do nothing to try to reverse it. Now, you need to do a lot more than just manage your blood sugar. Diabetes should not be all about management like it is in America. And like I also mentioned, we're not even looking at the right parameters whenever it comes to the diabetic patient and blood work. But first, let me go through what your body goes through in the development of diabetes. Now, it all starts with an over intake of sugar or carbohydrates. So eating too much sugar. Now, keep in mind, guys, I'm not talking about the white powdered sugar that you dump in your coffee. That's one thing. But I'm also talking about the foods that turn into sugars, like the pizzas and breads and pastas and rice. These foods turn into sugar by the time they hit your stomach. By the time you begin digesting them, they're already turned into sugar. The average American eats 7 times too many carbohydrates in their diet. Think about this. Whenever you go out to eat, first thing to hit the table is your drink, carbohydrate, or a beer, carbohydrate. And then they bring the bread, carbohydrate. Then they bring your salad, carbohydrate, and dressing on it, carbohydrate. Then they bring your entree with one little piece of protein and 2 more carbohydrates. And then you save room for another beer, carbohydrate, or dessert, carbohydrate, or both. Do you see how out of balance that is? And that's not to even mention the ice cream before bed and the donuts in the morning at the office. I could go on and on. So people eat way too much sugar and the body overproduces insulin for an extended period of time. And the cells begin to then over time become resistant to their insulin. Diabetes is called insulin resistant diabetes. And that's why. Insulin's job is to take the glucose in your food and put it inside the cell to be used for energy. So your cells burn glucose as fuel, just like your car burns gasoline for fuel. Insulin's job is to unlock the door in the cell wall and put the glucose inside the cell to be used and burned for energy. So when the cells stop getting their glucose, they think they're starving. So they send signals to your body to eat more sugar, so you begin to get worse sugar cravings. So that compounds the problem because the patient starts to eat more and more sugary foods because they're craving sugars all the time. Then what happens is all of this extra glucose builds up in the blood because it can't get inside of the cell, and it begins to spill over into the kidneys, and then we can find it into the urine when we do a urinalysis on the patient. So you'll notice that you begin to urinate more frequently because the way the kidneys are working. And this causes, because of this urinary frequency, that causes the blood to get too thick. So these patients are thirsty often. So they find themselves always thirsty. And when the blood gets too thick, poor circulation begins to occur, and the extremities get wounds that won't heal and feet that stay cold. And the next stage is the diabetic neuropathies, which is burning and tingling in the feet and legs. The tiny arteries in the eyes are affected so that your vision begins to fail. And since the cells use glucose for fuel and the cells are not getting their glucose, the patients are tired often. And as this progresses more and more, insulin must be put in the body and the cells get less and less able to use that insulin. And the cells become more and more deprived of glucose they need to function normally. The limbs begin to become really compromised and may need to be amputated or to prevent non-healing wounds and things like gangrene. And then by this time, blindness has set in, is very prevalent because of the tiny arteries in the eyes, and the process continues. The insulin becomes no longer able to keep up, and these patients sometimes can pass away from complications such as infection of the lower limbs or pneumonia or something that we call a comorbid disease. That means the diabetes doesn't kill you, but you had a different disease because of the diabetes, and that's what doomed your end of your life there. So, yeah, guys, there's no really such thing as normal diabetes, and it's a very dangerous way of thinking. And the scariest thing about this whole issue is people think, well, yeah, my lab work looks pretty good, and my blood sugar's holding steady, and my medication's working, so I'm pretty healthy. But remember, most of these terrible side effects happen to people that were managing their diabetes. So it's time for an entirely new approach. You may not have to go down this terrible pathway of what I just described in the progression of diabetes in a diabetic patient. Now, before this next break, I wanted to let you guys know that I'm hosting a free community workshop called 4 Secrets to the Diabetic Patient. I wanted to invite all of you guys to come. It's open to the public. If you're interested, you can call my office at 837-7174 and register or book your seat. They'll give you locations and all that. It's going to be July the 18th at 6:30 p.m. They'll tell you where to go and get your seat all booked. I do have limited seating available. I think it's already about half full. So if you want to come, call right away. Obviously, we're not in the office today. It's Saturday. Leave your name and number on my office machine. And when the girls get to work Monday, they'll give you a call. They'll get you your seats booked. That number again was 837-7174, 837-7174. More great information on diabetes when we get back. So don't go away. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. We're discussing diabetes, and I really appreciate all of you tuning in to learn about this chronic disease that so many people have in the Acadiana area. The diabetes rates in Acadiana, guys, is abysmal. We have to get a handle on this now. It's not good enough just to manage your blood sugar numbers and think that you're healthy. The average American now eats 180 pounds of sugar a year. So we are overeating and starving our body of nutrients at the same time. Now, remember in that last segment, I said that glucose is the fuel that your cells burn for energy. Your cells are genetically programmed to do that. And all of the cells in your body, when they're starting to malfunction, we always want to ask ourselves that very important question is, why are the cells doing what they're doing, and how can we make them function and work better or do something different? Your cells are genetically programmed to do what they're supposed to do. A muscle cell contracts. A stomach cell makes acid. A saliva cell makes saliva. A nerve cell transmits. And on throughout your whole body. Your cells are genetically programmed to perform a certain function. And when they're not performing that certain function in wellness-based care and in natural health care like what we do, we want to ask ourselves, why isn't that cell doing what it's genetically programmed to do? Something has to be stopping it. And if we can figure that out, if we can get as far upstream in these conditions as possible, and figure out ways to make the cells work better, amazing things can happen in the body in so many cases. But all of the actions of your body are fueled by glucose. Insulin is what puts the glucose inside the cell to be used for energy. So it's kind of like putting gasoline in your car. Without gasoline in your car, it has no energy. It has no way to do what it's supposed to do. Now, your cell wall is kind of like your gas cap, preventing you from putting gas in your tank. Now, if your car had one of those locking gas caps, where you had to get the key out and unlock it to put fuel in it, insulin is that key. Insulin unlocks the cell wall so that the glucose or the gasoline can go inside the cell to be used for fuel. Now, if that's not happening, if the cells can't work correctly, the secret to all of this is why isn't the lock working? Why can't insulin unlock the cell wall and put the sugar inside the cell where it belongs? Why can't insulin do what it's programmed to do? What's wrong with that mechanism? Is the lock broke? Has the key changed? What's going on with that? So the truth is there are several things that need to be looked at to see why the cells have stopped using their insulin. But unfortunately, that's not even discussed. It's not even looked into. They don't even test patients for insulin in the first place in the diabetic patient. I mean, if we're not testing insulin in something as important as diabetes, how will we ever figure out some of these underlying complex questions? And I understand that it's easier just to, pop a pill and keep going, but that could be a very dangerous way, for your future. Now, most of these diabetic medications like metformin, they basically whip your pancreas to make more insulin. And yes, that will bring your blood sugar down. So basically it would be like, okay, so you're putting gas in your car and the gas cap is locked, right? Remember, and the key's not working. Okay, so if we're going to just flood the body with extra insulin, that's basically like just ripping the gas cap off and putting fuel in anyway. And it will bring your blood sugar down. But if your insulin is 5, 6, or 7 times normal, that is also toxic to your body. Insulin in real high numbers is toxic to the body. So we don't know that because we don't test for insulin. So we have to look at this from a little bit different way than what has been done. So many patients are lulled into this false sense of normalcy when all you're looking at is your blood sugar and A1C numbers. We can do better than this, guys. There's lives at stake here. We can figure out a better pathway to deal with some of these chronic diseases. But you have to be willing to take the action to find out what can be done to resolve your individual cellular problems. But I see patients all the time that, unfortunately, they just don't want to be bothered with it. They're too busy. They have the kids and the bills and the job and the spouse and the house payment and the car payment and all these things. And listen, I know how it is. I'm like that too, but they put their health last. And guess what? Without your health, you can't do any of those other things. You can't make your house payment. You can't go to baseball games without your health. You can't pay for your car payment. You can't bring your spouse dancing. You can't pay your bills without your health. So solving your health problems should be at everyone's very top list of priorities. And I see patients every day that it's not even on their radar. It's not even in the top 20 things on their list of priorities. Is, hey, I need to pay attention to my health, because they think they're too busy. They're dealing with all these other things, but it needs to be. America is one of the unhealthiest nations on the planet, and Acadiana is one of the unhealthiest places in the United States. And I say that for no other reason, because I just care about y'all. I want to see you guys get better. I want to encourage everyone out there to turn this around, pay more attention, find out why you're developing these diseases, find out if there's anything we can do out there to improve your situation. And almost all the time, the answer is yes. There's lots of things that can be done to improve your situation. Just nobody has sit down and told you about them or figured them out with you. This stuff is complicated. You can't figure this out in a 3-minute office visit. You have to sit down and really dig into these cellular processes to try to find out why the cells are doing what they're doing, and is there anything that can be done to make them work better. So many times patients with diabetes will tell me, I'll say, well, what do you know about your diabetes? And they really don't have a clue. Like, they've never even looked it up. If someone tells you have a chronic disease as damaging as diabetes, you at least want to do a Google search to find out what that means at a cellular level. And I talk to patients all the time. They don't even, they have no clue what diabetes even means in their body, or kind of what the mechanism of that is. And you don't want to do that. You want to do your own research and see if there's things you could do to improve your situation. Because the way our healthcare system is today, you may not be able to rely on them to bail you out once it gets bad enough. We all need to be more proactive to stay healthy and do things that allow us to function better and have be healthier long term and have a better outlook and be on that pathway of the lady I talked about in the last segment that was 70 years old and shopping and gardening and playing with the grandkids, not the 70-year-old that's in the nursing facility or using a wheelchair or can't walk to the end of her driveway just to check her mail. So listen, folks, you have to get interested and take command of your own health care. You need to find out what's happening inside your body. And that's what this workshop is going to be about that I'm going to have on July the 18th. You will leave there with the best understanding of what's happening at a cellular level that has caused your cells to fail, that has caused your body to fail. You will also leave there with tons of things you could do right at home to try to improve your situation so that you don't end up with the blindness and the amputations and the kidney failures that come along with diabetes left to its own situation. The workshop is going to be July 18th at the Hampton Inn Conference Room right there in Broussard. If you want to register, you can call my office at 837-7174 and leave your name and number on the machine. Obviously, it's Saturday. We're not there. My staff will give you a call back Monday and get you booked and tell you the address and all that information. And so just leave your name on the machine and we'll give you a call back. And be by your phone Monday. You know, a lot of times we have to play phone tag. So if you call and leave your name, just kind of keep your phone handy Monday. We'll give you a call just as soon as we get there. That number is 837-7174. Stay tuned. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for tuning into the show today. I hope that I've been able to point out some very important topics on the terrible disease of diabetes. 1/3 of Americans have prediabetes. 50% of everyone over 65 has prediabetes. And in Acadiana, it's probably higher than that. And diabetes is a disease of insulin, not of blood sugar. But they don't even test insulin in the evaluation and management of diabetes in America. And why would we not want to know something so important as what your insulin level is in the management of the diabetic patient? Because insulin in too high of levels is toxic to the human body. And keep in mind, insulin's job is to put the glucose inside the cell for energy. And in diabetes, insulin can no longer do that. Insulin can no longer put the sugar inside the cell for use. And many of the diabetic medications out there just whip your pancreas to make more insulin. So if I flood your body with enough insulin, sure, it's just like ripping that gas cap off and forcing the sugar, forcing the gas in there anyway, forcing the sugar inside the cell. And that will bring your blood sugar down. But insulin in very high numbers is not good for the human body. But again, we don't even test it, so how do we know? Now, I'm going to give you an example of how insulin is toxic in high numbers. So let's just take Alzheimer's disease, for example. So they're now calling Alzheimer's diabetes of the brain because it directly relates to how your brain processes sugar. And according to the latest literature out there, people with diabetes have a 2 times greater risk of developing Alzheimer's. But if you take insulin or your insulin is too high, your risk goes to 4 times greater risk of developing Alzheimer's because insulin is toxic in high numbers in humans. So we want to look at insulin. We want to test your insulin levels with our lab. We want to test your leptin levels. Leptin is insulin's boss. That's what controls insulin in the first place. So we have to check your leptin levels, which is another hormone, to see if it's off for some reason. And the number one way we control your leptin levels is through dietary factors. Dietary changes done the way we do it is simple and it's loaded with great foods. Our meal plans are full of foods with lots of flavor, lots of high fats, healthy fats that are fulfilling and satisfying. And at the workshop, I'm going to show you the perfect eating schedule and the perfect food calendar on timing and food choices for the diabetic patient. And we'll begin to look at the right stuff when you're trying to solve diabetes and what you should do in order to really get this thing under control. And there's a lot more to it than just diet. Don't get me wrong there. We're going to talk about several other things other than that, but we will touch on that at the program. We also want to check inflammatory factors. We want to check cellular functioning markers. We want to check your cortisol levels using your stress glands. And we're going to go through all of that at the workshop. We're going to get the clearest picture we possibly can of why the body's insulin has stopped and what we can do to try to get it to work again. Like I said earlier, to try to get as far upstream in these conditions as we possibly can. And we always ask that question, why are the cells doing this? And what can we do to make it work better? And the answer to that question usually is lots of things. There's tons of natural things you can do to make your body's process its sugar better and work better. So I really hope you guys will take this step and come spend an hour out of your life to hear the secrets that just might allow you to be on a healthier pathway. So when you're 70 years old, you're golfing or gardening or playing with your grandkids or doing all the things that you enjoy, instead of that 70-year-old that's in the nursing facility or wheelchair. And so thank you guys for listening. If you want to call and register for my 4 secrets to the diabetic patient, that number again is 837-7174. Just leave your number on the machine. It's 837-7174. My only purpose is to try to help you guys and to show you a better way of life. So thank you guys for listening. Look forward to seeing all of you at the workshop. Don't miss my Facebook show Thursdays at noon on the Bryant Wellness Institute Facebook page. It's called Dr. Kevin Live and Online. It's an interactive show that I do every Thursdays at noon. And that number to call again was 837-7174. Thank you guys. Have a good weekend.